Hey guys, and welcome back to my channel. So I know you guys see that the setting is different. I am in my room right now, and I got the idea from my friend, talking to my friend last night, and she was like, you should do a video of you studying instead of just telling people like, oh yeah, I have a quiz coming up and this is what I got. Actually show them how you study. So yeah, you guys are going to be studying with me. And it's funny because okay, I have my pediatrics final tomorrow, so that's what I'm going to be studying for. To study for my final exam for pediatrics, I have my notes for pediatrics that I took throughout the course, and then my teacher gave us a final exam review, and yesterday during work I just highlighted like the important points, and then she also gave us pediatrics assessment tools. So it has all the normal pediatric vital signs, and then also a pediatric assessment. It was a true and false that we went over in class. So that's basically what I'm going to be using to study. So for the pediatric assessment that we did, it's basically all true or false that she gave us, and so I'm just going to go down and read them. So, number 3, when examining an infant, you should begin with the most intrusive things first because this is when the child is most relaxed. This is false. Do not go poking on the kid first. We never got to take care of a child, but from the textbook, I remember it said that the first thing you want to do is respirations, and you don't touch the child at all. You just watch their abdomen for breathing. If you don't know, children usually breathe through their abdomen. Like babies, infants, they usually breathe through their abdomen, not their chest. So that's what you want to watch first for respirations, because once you start touching the kid, like the child or the baby, they start moving, and it makes it just harder to do everything else. So you always want to do the least intrusive things first. Number 4, the use of dolls or toys are useful tools in the nurse's interaction with the child. This is true. In order to get kids to be comfortable, you always want to show them what's going to be happening. So if you're going to give them an injection, it'll be helpful to have a doll and have like a needleless needle and have the child play with the doll and show them like, this is what's going to be happening to you. This is what we're going to do, and have the child do it, or have the child touch the needleless needle to see, like, so they're not scared, you know. You want to get the child comfortable. Number 8, fontanelles that are depressed indicate increased cranial pressure, while bulging fontanelles indicate dehydration. This is false. It's switched. Intracranial pressure, the fontanelles will be bulging. If you think about it, if there's pressure, it's going to be squeezing the fontanelles up. And dehydration, you know, with dehydration, things are usually sunken. Under the eyes are sunken for the child, the fontanelles are going to be sunken as well. Number 9, when examining a toddler's ears, you need to pull the auricle down and back. This is true. And this is what confused me, because in the textbook it said with an infant you pull down and back, and with a child you pull up and back. So I thought that a toddler counted as a child. So I originally put that for a toddler you will pull up and back, but my teacher said no. Toddlers, they still count as infants in a way, like younger children. So when you want to examine their ears, remember, pull down and back. And also for infants, you know, it's easier for them to get infections because their eustachian tube is shorter, straighter, and wider. Okay. It is encouraged to have a baby go to bed with a milk bottle, as this helps them fall asleep more quickly. This is false. You never want to keep a milk bottle in the baby's mouth when they're sleeping. There's a risk for aspiration, and there's also a risk for ear infections. I know a lot of people do it. You know, some people still do it anyway. Even my teacher that's a nurse, she said she used to do it. Prop the bottle, keep the baby quiet, but it's a big no-no. You don't want to do that. Number 14, as a child becomes older and grows larger, the heart rate decreases. This is true. Usually the normal vital signs for an infant is, for their heart rate, is 110 to 160 beats per minute. So, and you know, for adults, if your heart is beating that fast, you're like gonna die. So it's false. Well, I mean, it's true. Yes, it decreases as the child goes older. Okay, number 16, the nurse looks for asymmetry in the shoulders, arms, hips when screening for scoliosis. I thought this was false because scoliosis, usually you're checking for the spine to see that the spine is straight. Well, they're also checking to see if your shoulders are symmetrical, because that's an indicator if your spine is straight or not. If your shoulder is like this, you know that something's going on with their spine, so it's actually true. Okay, guys, so I'm kind of running out of space for the video, so I'm just going to go over this final exam review that my teacher gave. I'm going to run through it real quick, and then I'll end the video there. So, growth and development is orderly and proceeds from simple to more complex, so that's a basic. Cephalocaudal and proximodistal growth and development is orderly but different for every child. So, cephalocaudal growth and development is basically from head to toe. So kind of like you sit before you could walk. I don't know how else to describe it, but it means that. I don't know how else to describe it, but cephalocaudal, think of like the child sits before they could stand, or the child stands before they could walk. Like it's in order. And proximodistal, kind of think like the child from in proximo distal. So like, I don't know how to describe it. I'll say like the child could grab before like doing more fine motor skills. If that makes sense. I'm really bad at this. Like, I can only think of ways that make sense to myself. I can't really teach. The infant is in the oral stage of development and therefore derives all pleasure from sucking. So this is for infants. This is the oral stage of development, and they derive pleasure from sucking. This is why infants are always trying to put things in their mouth. It's very annoying, yes, but they're in the oral stage. Infants 12 months and younger need non-nutritive oral stimulation if NPO for any reason or between feedings. This basically means that you could give them a pacifier if they're NPO, but no food, of course. And they have higher metabolic needs than adults because of their rapid growth rate. You should know that because children eat like little monsters. They just eat. Okay. So for infants, they need visual and auditory stimulation. Lack of them may cause developmental delays. So you don't want to overstimulate them, but they always need stimulation. First deciduous teeth appear at 6 months. And you want to introduce solid foods around 4 to 6 months, depending on where your child is at. It's usually 4 to 6 months. And you want to introduce a new food every 5 to 7 days. You don't want to just give them one food today and then be like, okay, I'm going to make them try another food tomorrow. No, you want to stretch it out. And also the first food that you want to give a child is always rice cereal. And that's about at 6 months. See, the first solid food should be rice cereal at 5 to 6 months. Babbling also starts at 5 to 6 months. And the developmental task in infants is trust versus mistrust. For toddlers, at 15 months, they can usually walk alone. Their developmental stage is autonomy versus shame and doubt. So they always want to do things by themselves for toddlers. And they also exhibit negativism. So this is the no stage. You know, all toddlers, my nephew is going through it right now. It's kind of annoying, but everything is no. No. Do you want this? No. But yeah, he really wants it. It's that stage of autonomy. The Denver Developmental Screening Test assesses for the development of children during the first 6 years of life. Discipline should be viewed as a teaching tool, and for timeouts, the rule is 1 minute per year of age. So a 1-year-old, toddler is like 2-year-old. So 2-year-old will get 2 minutes timeout, 3-year-old 3 minutes, so on and so forth. And toddlers traditionally play alongside each other. This is known as parallel play. So parallel play is we could be doing the same thing, but I'm not going to interact with you. You're doing what I'm doing, but we're just in our own world. I could be watching you and being like, oh, he's doing that with the action figure. I'll do the same thing, but we're not even communicating. So that's parallel play. And a 3-year-old will not want to share his or her toys. Cooperative play begins around age 4. So cooperative play is like playing house, for example. You're going to be the mommy, I'm going to be the daddy, and you stay with those roles. Toddlers may not be able to sit at the table to eat. If this happens, they should be given finger foods. And a typical 3-year-old is pleasant and wants to play or help. And then the review goes on with school age, preschool, adolescent. I don't think I could fit everything in the video, but this is basically how I study, guys. I don't want to... I wish I could go longer with the video, but I have like a 15-minute time that I want to keep, so I'm going way over it. But I'll just hit a couple more points and then I'll end the video there. For newborns, you want to take their temperature via the axillary route, so under their arms. And also remember that because of the immature liver and kidney function, med levels may reach toxic levels quickly in infants. And they also get otitis media, which is ear infections. And I think I said this before because their eustachian tube is shorter, straighter, and wider. Race syndrome. Race syndrome can be an effect of aspirin or any salicylate. So it's acute non-inflammatory encephalopathy and hepatopathy. So it affects the brain and the liver. Follows a viral infection in children, can be initiated by the use of aspirin given during a viral flu or illness. And in children, the onset of effortless vomiting is an indicator of the presence of Ray's syndrome. I cannot talk, guys. And then, what else? Musculoskeletal, fractures. Children heal more rapidly when they get fractures, and if you ever see a spiral fracture on a child, that is an indicator of abuse, because it's hard to really twist unless someone's really twisting, you know what I mean? And if someone gets a soft tissue injury, the acronym is RICE, rest, ice, compression, elevation. In infants, the respiratory rate is best assessed by observing the rise and fall of the abdomen. I think I said that before. The tripod position, this is how you know if a child is having difficulty breathing. They're usually leaning forward with hands on the knees or leaning on the table. There's also if the child is having a TET spell, they're usually squatting, and that's to help them breathe better. A tonsillectomy can be done in the day of surgery, and after a tonsillectomy, you always want to check for frequent swallowing, because that's an indication of bleeding, and that is not good because that could lead to aspiration and a whole bunch of other stuff. So you always want to assess for frequent swallowing. Okay, I said that. That's what was next. Let's see. Yeah, I think I'm gonna end it there, guys, because I'm really running out of space and I can't fit everything in. Thanks for watching, and I don't know, hopefully this helped you guys out in some way. This is usually how I just speed through. I'll probably do this 2 or 3 more times, and then, yeah, I usually go to sleep after that. I usually like to study at night just because it stays in my mind longer. Like, it stays in my mind, and I wake up thinking about it. I don't know if that sounds weird, but I study at night, I sleep, it's in my dreams, I wake up, I still think about it, and then I go take the test, and I get an A. So, wish me luck on my exam, guys. I'm going to go ahead and finish up studying. Like I said, go through this a couple more times. And yeah, I hope you liked this video. If it helped you in any way, maybe I gave you some facts that you didn't know, or maybe I helped you if you're taking peds soon. But maybe I didn't help you at all. And if I didn't, thanks for still watching. But yeah, guys, I hope you liked this video. Don't forget to give it a like, comment, and subscribe. Bye, guys. I'm your fantasy, but you ain't shit.